Thank you, Professor Arun Jain. Uh, Tissue adhesives is a very important modality for treatment of corneal perforations, and all of us who work in cornea are well aware that we can need it anytime, and we do not want to exhaust our stock of tissue adhesive because it's very safe and very effective to treat corneal perforations. We have options of using either synthetic or biological tissue adhesives. We have both options open to us. The synthetic tissue adhesives, they are basically ethylate and then nitrite and then side chain. And this is the basic structure. And once this cyanoacrylate comes in contact with OH ions, the monomers are converted into cyanoacrylate polymers, and there is a CTA plug which is formed and which seals the corneal perforation basically. And the main property is that as the side chain increases, the rate of polymerization decreases, and that is the reason you can't use methyl cyanoacrylate or crazy glue for sealing the corneal perforations, and you have to use either octyl or butyl derivatives. Once they degrade on coming contact with water, they release formaldehyde and cyanoacrylate, and there too it is the longevity of the side chain which decreases the rate of depolymerization and also the toxicity to the tissue basically. These are some of the commonly used tissue adhesives. Earlier we used to have a lot of difficulty in procuring these because they were not available. Now it's freely available in our own country, and anybody can have access to that. These are some of the indications like corneal perforation less than 3 millimeter, or like impending corneal perforations, or even infective corneal perforations. We can use tissue adhesives. The key is to diagnose corneal perforation, and some of the signs are iris presenting at the site, which becomes an obvious corneal perforation. And if you have a shallow AC, we can have a descemetocele which is leaking. We can also have sometimes radial folds in the cornea, which indicates that there is an impending perforation. And sometimes if you are treating a corneal ulcer and hemorrhage develops, that is also an indication that we may be having a corneal perforation. The key is that this clinical impression need to be confirmed on Seidel test, and there are basically two ways. One is to use concentrated fluorescein, which looks brown on slit lamp and with the cobalt blue filter, and in case there is a leak, you will see this kind of green leak. Or if you use diluted fluorescein, then you will see clearing of the leak. In case you are having a patient with dry eye, you need to put a lot of fluid. Little bit on the technique basically. The key is to use minimum amount of tissue adhesive, whether you use insulin syringe with fine needle, or there are some other methods also. You can use toothpicks or something. But the key is to de-epithelize the perforation surrounding area, so that the tissue adhesive plug sticks clearly to it, and also make the corneal perforation dry using a cellulose sponge, so that the cyanoacrylate tissue doesn't enter into the anterior chamber. These are some of the patients treated with the cyanoacrylate tissue adhesive, and this is one of the patient having fungal ulcer treated with this one. There is some problem when we use tissue adhesives, especially cyanoacrylate derivatives for the larger perforations. I have used a scleral patch in these patients and then applied the cyanoacrylate tissue adhesives. In some cases we have applied sutures and others without sutures, and had beautiful healing without inducing any astigmatism in case it is a peripheral perforation. This is how it works. You have a scleral patch and above that CTA, and this is basically to provide a scaffold so that the tissue can grow along with that. This is another patient being treated with the similar approach without putting any suture in this one. This is again a corneal ulceration and impending perforation where we have used cyanoacrylate to decrease the collagenolisis and decrease the melt. In case you have severe chemical injuries and all other modalities have failed, you can also use cyanoacrylate tissue adhesive to arrest the corneal melt. This is one patient long time back. I treated him. He has lost one eye because of the infection due to severe chemical injury with adnexial injuries, and the other eye we could save, and after doing repeated surgeries we could make him mobile. He had 636 vision when he last came to follow. Biological tissue adhesives, of course, these days we have commercially available tissue adhesives. Earlier we used to make in the laboratory. For application, the technique is almost similar. Only thing is that you have to use the two solutions simultaneously. We have available a common cannula, two syringes attached, and you have to wait a little longer. And the advantage of the fibrin glue is that it has homeostatic property, then adhesive property. In addition, it promotes the healings. I will not go into the details of the basics, but this can be used even to like close the conjunctiva following strabismus surgery, or even leaking blebs can be treated. Even pterygium surgery, it can be used to adhere the conjunctival flap or to the amniotic membrane. And we have also used this one in the perforation, and we have compared it with the CTA with very good results. And this paper was published long time back in Ophthalmology, has maximum citations. And again, fibrin glue we found was equally effective, and in addition, it decreased the vascularization and provided faster healing also. So we have a better ocular surface to provide for corneal transplantation. We have sufficient experience in the using these tissue adhesives, and in most recent innovation, I have started using a scleral flap in the interlamellar pocket for larger perforations, and then applying glue to treat these perforations. We have new innovations coming in this area. We have some of the newer tissue adhesives molecules which are transparent, through which we can see what is happening to the underlying cornea. I would like to emphasize that the corneal perforations are sometimes elusive, and this is like this picture. We are seeing these camels basically, but these are not camels. These are just the shadows. And the camels are basically, this is the aerial photograph, and this is the camel here, this shadow, and these black camels we are seeing, they are all shadows basically. So sometimes it can be deceptive, and we have to do the Seidel test to diagnose corneal perforation. Thank you very much.